Okay, we're going to be covering the brain on cross-sectional anatomy. So looking here, this is an MRI T2, and we know this because the fat is bright. So if we take a look here, we have, it's kind of a dark image, so it's hard to see. You'll be able to label all of these on the brain, which is going to be really cool. It's nice when you get there. So it's kind of painful getting there, but it's always nice once you do get there. So looking at the brain here, this is an MRI and it's a T2. And I know it's a T2 because the fluid within the ventricles is nice and bright. So all within here, it's nice and bright. So this is the fluid in here. Okay, so we can see. Now this is a tumor. So the tumor has broken the blood-brain barrier. So if we gave contrast, this would light up. So it's more metabolic than the brain tissue. So it's going to enhance. So this right here is a brain tumor. And you can see we have what's called midline shift. So this line to this line here on your sagittal plane. So you can see that it's shifted a little bit to the right. So we have some mass effect. It's called mass effect with midline shift. So that's bad. All right. So taking a look here, we're going to start with our dural sinus, starting off strong. We've got our cranium, and within our meninges, we have our dura mater, arachnoid membrane, and pia mater. So you have your cerebral cortex, and you have your phalanx cerebri, and your subarachnoid space with your arachnoid granulations, and you can actually see these within the skull. It's kind of cool. Arachnoid villi, and I'll point those out to you when we get to them, okay? So looking here, when we scan the brain, it's normal to be at an angle, so this is normal, so we're going to be looking at an axial. Okay, so here's our axial. This is a CT, and if you look here, we have our phalanx cerebri, and we have our lateral ventricle. This is our third ventricle. This is our tentorium cerebelli on both sides, okay? So it's like a mesh, a netting, and you can see it right there also, and a piece of it right there. This is our frontal lobe of our brain. Okay, we're going to be looking at a coronal. So you can see we're going to be posterior. So you can see here, we're posterior. So right here, phalanx cerebri, here's our cerebellum, so left and right, you can see the R and the L, so right side, left side. We have our tentorium cerebelli, so you can see it's dividing between the cerebellum and your cerebrum, okay? So we have like a little mesh down here and in here, okay? So looking here, this is a sagittal plane. So if we look, we have the cerebrum and we have the tentorium cerebelli. You can see it right there. We have our phalanx cerebri and our cerebellum and our subarachnoid space and our dura mater. So you can see that white line. So let me put on, let me draw this so that you can be sure you know what I'm talking about. So right here on that line, that is your dura mater, and underneath that, the lighter gray, or I should say darker gray, is your subarachnoid space, okay? So coming up, we're looking at the ventricles here. So we've got our frontal horn of the lateral ventricle, and it comes across, and we have our trigone, and our occipital horn of the lateral ventricle. Coming around, we have our temporal horn. So it's down in the temporal lobe, okay? So frontal horn with the frontal lobe of the brain, and we have occipital horn, which is the posterior, the occipital portion of the brain, and then our temporal horn. We have our foramen Monro right here where the two communicate. And we have our, I want you to know, the trigone and the cerebral aqueduct. So the aqueduct of Sylvus, so right here, and this is our fourth ventricle right here. So this whole thing is the third ventricle comes down the cerebral aqueduct into the fourth ventricle. Okay, so the central canal heading down and out. Those are the most important parts that I want you to know. Looking at it straight on, we have the frontal horn, and this is the temporal horn, and then we have the body of the left lateral and the body of the right lateral. Here's our third ventricle right here coming down the cerebral aqueduct into the fourth ventricle, which heads out to our central canal. Those are the most important. You can see our foramen Monro right in between the two that connects the two to the third ventricle. So it goes your lateral ventricles, okay? So at the frontal horn, then you have your foramen of Monroe goes down to your third ventricle, down the cerebral aqueduct to your fourth ventricle, and out to your central canal. So looking here, this is looking at the top down, I believe, and we've got our frontal horn of our left lateral ventricle. We have our third ventricle here in the middle. Here's our temporal horn of our lateral ventricle, occipital horn, and our fourth ventricle is down here. So it goes third, cerebral aqueduct, fourth. Okay, so this is the body of the right lateral. This is the body of the left lateral ventricle. So we're going to do an axial slice right here. We're going through the ventricles. Let's take a look. So this is what it looks like. We have the frontal horn of the lateral ventricle, and this is it right here. So right there, that's of the left ventricle. Here's the frontal horn of the right ventricle right there. And then we have the septum and then the thalamus. So the thalamus is all right here. So this is the thalamus right there, okay? And the third ventricle runs right down the middle of it. So right through the middle is your third ventricle. Coming back, we have the occipital horn of the lateral ventricle, and this is of the left side, and this is the occipital horn of the lateral ventricle of the right side, okay? Inside the ventricle there, let me just get a different color so you can see. Right here, they put the arrows right on them, of course. So this little doodad right in the middle, so this little guy right there, that is your coracoid plexus. So right here. So this makes your CSF right there. Okay, so you see that little guy right in there? That is your coracoid plexus. And they calcify a lot of the times along with the pineal gland, which is right here. So this is the pineal gland right there, and it calcifies. So when it calcifies, you can see them really well on CT. Not so much in MRI. MRI, we can see them pretty easily as it is, but then when we get them in CT and they're calcified, it's much easier. Okay, so we're going to look at another axial. And this is a CT. So you can see the frontal horn of the lateral ventricle. So this is the left frontal horn of the lateral ventricle. You can see here, this is your septum pellucidum. And then we have our third ventricle right here. So coming down, so our thalamus gland is right in here on both sides, not just on one, it's on both sides. And then looking a little bit lower here, so this is an important one because it lets you see the temporal horn. So here's your frontal lobe right up front, and then we've got your temporal lobe here. This is your pons. This is your fourth ventricle. This is what it looks like right there. And then these on both sides right here on both sides. So this little gray round spot, that is your temporal horn of the lateral ventricle. So this is the left side, this is the right side. But you have to be pretty low to see this. So you usually see the fourth ventricle right here. So this is the fourth ventricle right here, okay? So you usually see the fourth ventricle and you can see your temporal lobes, okay, of your lateral occipital, your lateral ventricle. Phew, easy for me to say. Okay, so we have a sagittal plane right here. We're going midline, straight down the middle, okay? This is what it looks like. This is an MRI and this is a T1, and I know this because the fluid is not bright. So I take a look here and I've got, right here is the splenium, so we'll talk about that in just a minute. This is your lateral ventricle. This is your thalamus right there. This is your cerebral aqueduct coming right down there. And we've got your fourth ventricle right here, okay? So lateral ventricle, we've got your thalamus, we've got your cerebral aqueduct coming down. This is your cerebellum right here. And I want you to know your fourth ventricle. Here below, so here's your occipital bone. So let me draw this in for you right here. So your occipital bone comes down right here. So this is your occipital bone. And then you can see that you have your foramen magnum right through here. So this is the opening, okay? So you have your cerebellum right here. So your cerebellar tonsil right here, so this portion right here, if it's too much lower than the bottom of the occipital bone coming across, then it's called Chiari. So Chiari. So there's different grades of Chiari. And a lot of people, they'll have half their cerebellum down below their foramen magnum. So it's a different grade depending on how low it is. So some people would come in to me for MRI and say, every time I look up, I pass out. I'm like, well, stop looking up. That's an easy solution. But what it is every time they look up, it pinches their cerebellum and they pass out. So it's pretty interesting. They can do surgery to fix this. I haven't seen a surgery go well. We'll just put it that way. So if you can live with it, it's better. But it is not uncommon to see the cerebellum below the occipital bone, and it's called Chiari syndrome. So this is a cistern magna. So it fills in this whole section down here. It's pretty crazy. All right, here's your medulla oblongata. Here is your pons and your midbrain. So midbrain, pons, and your medulla oblongata, and that goes down into your spinal cord, okay? So suprasellar cistern. So your sella turcica, remember we talked about that? So it's right here. Here's your saddle. So this is your saddle right here. So coming around, and your pituitary gland sits in the saddle. So this whole thing is your pituitary gland that sits in your sella turcica. Right above it is your suprasellar cistern. So it's like a little cavity. A cistern is usually like a cavity. So it has a suprasellar cistern, and it has fat or fluid or something in it. And then this white line is your optic chiasm. So your optic chiasm. So that's right where your optic nerve crosses over. Okay. So a lot of patients will come in for MRI and they have sudden onset of blurry vision. So we're like, okay, sudden onset of blurry vision, glasses don't fix it, nothing fixes it. And what it is typically a pituitary adenoma. So a tumor growing here, and it comes up and it pushes on this optic chiasm, and it gives them blurry vision. So we do a lot of scans of pituitary adenomas for this reason. Very common, very common. All right, so we're going a little bit lower on this slice. It's an axial. This is a CT. So if we look here, we have our frontal lobe. This is our temporal. Here's our fourth ventricle. You can see a piece of the right horn of your ventricle. This is your pons, your cerebellum back here, okay? Don't overthink it. This is your tentorium. You can see how it's white and kind of bright. So this is your tentorium cerebelli, okay? So that's that meshing between the different lobes of the brain. Okay, we're going to be looking at a coronal. We're going pretty midline. You can see we're catching a piece of the pons. Let's take a look. All right, so Phalanx cerebri, we have the lateral ventricle. So this is your left lateral ventricle. Here is your third ventricle coming down. We have the optic tract. So right here, this is, let's see where we're at. So this is posterior to it crossing. So you can see if you go right up above the pituitary gland. So here's your pituitary gland right here. So if you're north of that, that's your suprasellar cistern and right where your optic chiasm is. And you can see we're posterior to that. So this is the optic tract. So this is posterior. And this is the temporal horn of your lateral ventricles on both sides. So right in here. So this is your left lateral temporal horn, and this is your right temporal horn of your lateral ventricle. Kind of cool, huh? And then your third just comes right down the middle. You can see it there. This right here is your basilar artery. So it's coming up and bifurcating. So it's a great shot of that. And a piece of your pons right there. It's a great shot. Okay, we're going further back, more posterior, as you can see. Let's take a look at what we got. This is an MRI. This is a T1. Looks like, yeah, okay. So I was going to say, is there contrast on board? I'm catching some brightness, but I don't think so. So here is your phalanx. We get some weird artifacts sometimes. So here's your phalanx cerebri right down the middle. Here's the occipital horn of the lateral ventricle, and you can see the choroid plexus in there. So that little piece right there. Here's your tentorium cerebelli and your fourth ventricle right here. We're too posterior for the third, okay? So we're doing an axial slice now. We're pretty high up. We're at third ventricle, just above it. So we're looking at the septum pellucidum, and you can see our coracoid plexus on the CT scan. It is calcified. And our occipital horn of our lateral ventricle. All right, so we're going to be heading into a coronal, and you can see we're pretty far posterior. So let's take a look and see what we got here. This is a CT. Oh, this is a good shot of the calcified choroid plexus. So you can see right there, it's calcified, so it's nice and white. So you can see your tentorium cerebelli, and here is your cerebellum, and your fourth ventricle is right there. So CT, you can see calcifications really, really well, easily seen. And your pineal gland actually is right there. So this right here is your pineal gland. So we're going to go into an axial, and we're pretty low. Here's your pituitary gland, so let's see where we're at. This is an axial MRI T2, okay, so we have lateral fissure, middle cerebral artery. So we have the left middle cerebral artery. Here's the right middle cerebral. This is your suprasellar cistern. So as you can see, it looks like there's fat in there. That's totally normal. So that's like a little cushion between the pituitary gland and your optic chiasm. So coming in here, I want you to know your midbrain, your ambient cistern, and we've got your quadrigeminal cistern, which is back here. Vermis of the cerebellum, so it looks like a worm to me, and I'll show you on a better image. You have your cerebral aqueduct coming down, so that's going from your third ventricle down to your fourth ventricle, and that's just right there. And I want you to know your posterior cerebral artery sits in your ambient cisterns on either side, and that works. And looking here, we're a little bit lower, so we're down into the pituitary gland. Should be at least. Oh, they're giving us an IAC, so we're cutting through the middle ear. So let's take a look here. So if we start, we have the basilar artery, so right here. So this is the inner ear. So these are on both sides the inner ear. So that's the right inner ear, and this is the left. We call them IACs. Here is your pre-pontine cistern, so this whole white area. I call it the CPA, and I'll show you on another right here. So cerebellar pontoon angle cistern, so it's a CPA. So this white is the CPA, and it goes from IAC to IAC, and it has the basilar artery in the middle. One of my radiologists one time missed a basilar artery clot, and it was on a young patient. He was only like 37, and went home. He had a severe headache. They sent him home because everything was negative. I scanned him the night before, and he had severe headache with vomiting and vertigo and everything. He came back the next morning. They called me and said, we need to get in here right now. So I came in. They had a helicopter on the roof waiting. I scanned him again, and we could see the clot, and he actually stroked out. He's, I'm sure, a vegetable at this point. He did survive, but we life flighted him out, and I can guarantee that was a very expensive case because the wife came in and requested all films and reports. So, so sad. So always know in the CPA, there's a basilar artery that comes up and feeds the whole posterior portion of the brain. So you have the fourth ventricle right here. Here's your cerebellum all back here, and your pons right in there, okay? So within the CPA, I let you guys get away with CPA, and there's the basilar artery, and then you have cranial nerves 7 and 8 that run into the ears, so you can see your cochlea and your semicircular canal. So cochlea, semicircular canal, remember the pigtail? All right. So looking here, this is a CT. This is an axial CT. We have the frontal sinus up front. We have the left, they say it's a left orbit, but I can't really see the orbit. I see the optic nerve. Here is your sella turcica with the pituitary gland within it. And they say that this is the basilar artery in the CPA. I don't know. It's a stretch, kind of hard to see. Here's your pons. This is your fourth ventricle. Cistern magna is right there. This is your cerebellum back here. Okay, so your CPA comes all the way around, and the basilar artery is supposed to be right there, but we don't see it, which is normal. It's fine on CT. We get a lot better detail within MRI. So if you look at this image and you look at this image, there's huge difference in the detail. So if we're scanning any kind of nerves or brain tissue, we want to use MRI. If we're looking for a bleed or a stroke, we can see it in CT. Typically, we see it in CT after the damage is done, so it needs to be over so many hours, a couple hours. MRI, we can miss strokes really easy because the death in the brain has not happened. So what happens is the fluid gets trapped inside the cells and it doesn't filter in and out. So it gets trapped inside the cell, and so you'll see a lot of fluid in the area of the stroke. All right. So if we're looking here, we're going even lower, so we should be well within the pituitary gland, if not all the way through it, and looking at the sphenoid sinus. So let's see. Oh, of course, we don't have an image. So looking here, we have, we're going to start up here. We have the pre-central gyrus with our central gyrus and our post-central gyrus. So important areas, looking at strokes on patients. So here's our parietal lobe, our occipital lobe, our cerebellum, our temporal lobe. Here's our pons. Here's our sylvian fissure. So we always look at this area for speech. We have our frontal lobe and our gyrus. So it's all the little grooves within the brain, okay? So here we're going to be looking, it looks like at the temporal lobe, we're heading far right and from midline right. So we're going to be looking at sagittal. And here we are. So we have our pre-central gyrus with our central sulcus and then our post-central gyrus, okay? So this is an area that the radiologists look at a lot. It does affect strokes, so it's important that we do look at that area. Here's our parietal lobe, our occipital lobe, our cerebellum, our temporal lobe, and then you can see right here our lateral fissure, or we call it the sylvian fissure. Either one is fine. Here's Boca's area coming up right here, so a lot of speech, and our frontal lobe. Okay, so looking here, we have our longitudinal fissure, okay? And we have our, I want you to know the frontal lobe, and our frontal horn of the lateral ventricle is right there. We've got our thalamus, so it looks like a heart when we're in the coronal plane, so it looks like a heart. That's our thalamus gland. We have our insula, which is a thicker area right within the sulcus, and I'll show you what that looks like. We have our external capsule and temporal lobe, internal capsule, optic tract, so you can see the optic nerve within that tract, so on both sides. We have our mammary bodies, and we have our parahippocampal gyrus, so it kind of swirls. We have our lentiform nucleus. Within the lentiform nucleus, we have the putamen and the globus pallidus. So lentiform nucleus usually works for me. Third ventricle coming right down, right here. And we've got our, which one? Oh, claustrum right here. So this little S shape. The head of the caudate nucleus is right here on either side. And then we go into white matter, and the gray matter is the little darker area. And our corpus callosum. So we're going to learn about the corpus callosum, okay? So it's a bundle of nerve fibers, okay? Here is a coronal image, and we're looking at the longitudinal fissure. I want you to know the white matter, and you can see the gray matter around the outside. Here is our lateral ventricle right there, okay? So this area, well, here's our thalamus, so you can see the heart. So if I were to draw it, let's see if I can draw this. So if we come around here, and then it comes up and around. So that is our thalamus gland, okay? Here is our lateral fissure and our insula right in here. So it's kind of fluffy right in here. So this gray, darker gray area right there, okay? And we have our temporal lobe is down here. So the insula is within our temporal lobe. And here's our parietal lobe up top, okay? Here's our longitudinal fissure. Okay, we're going to be cutting through pretty much midline. Let's take a look and see what we got. Oh, of course, no image again. What the heck is going on? I think I got a little too crazy and was deleting stuff trying to make this more streamlined, so I apologize. So this is a sagittal drawing. So if we start with the body, so actually I'm going to start over here. So this is the gnu of the corpus callosum. Then we have the body of the corpus callosum and the splenium of the corpus callosum. So we have right down here, rostrum, gnu, body, splenium, okay, of the corpus callosum. So rostrum, gnu, body, and splenium, okay? So if we come up and we go, third ventricle is here, and then we have the cerebral aqueduct coming down to the fourth ventricle. Remember this? We come around, here's our pineal gland right there, and we've got our cerebellum, posterior commissure. We didn't cover that yet. Here is our mass intermedia and our anterior commissure. So anterior, posterior. So there's the two communications. And I want to cover cingulate gyrus. So it's just along the corpus callosum. So it just runs right along it. Okay. I don't want you guys to get too hung up on that. So here's midline. So let's take a look at what we got. So it's a good sagittal. This is a Sag T1. So if we look, we start down here. We're going to start at the bottom this time, okay? We're going to go out of order. So we have the rostrum of the corpus callosum comes around to the gnu. So it's like a canoe is making a turn. Gnu of the corpus callosum to the body of the corpus callosum to the splenium of the corpus callosum. Okay, so those are the three. This is your thalamus right here. Coming down, we've got your posterior commissure. We've got your anterior commissure in here. And here's our cerebral aqueduct right through here, and it's going to our fourth ventricle. So this is our midbrain, our pons, and our medulla oblongata. Oof, right? Don't overthink it. Keep it simple. Rostrum, gnu, body, splenium, thalamus, anterior, posterior, third ventricle, down the cerebral aqueduct to the fourth ventricle. Okay? Midbrain, pons, medulla oblongata. All right, here's an axial. T1, MRI T1. Here's our longitudinal fissure. Here's our gnu of our corpus callosum. And we've got our lateral ventricle right there. This is our septum pellucidum. And then we have our third ventricle right here with our thalamus gland coming around it, okay? And this is our occipital horn of our lateral ventricle. And insulas right here. So this is the insula. So this is our lateral fissure, Sylvian fissure, okay? So we're going here. So we're kind of tipping through the pituitary gland. So looking here, we have the longitudinal fissure, the body of the corpus callosum. Here's our lateral ventricle left and our right lateral ventricle. And we're coming down, we have the suprasellar cistern. So here's the pituitary gland. This darker gray is the suprasellar cistern. So it's just like a layer of fat. And then we have our optic chiasm right there. So this is the insula. So this is our lateral fissure, Sylvian fissure. This is the white matter and then the gray matter all around, okay? So here's an axial. So if we take a look here, if you... with the trained eye, you'll start to see all the little densities, okay? So this is what the radiologist is looking at. So if we look here, we have anterior commissure, we have our thalamus gland coming around, we have our posterior commissure, and in between is our third ventricle. In between is our third ventricle, the occipital horn of the lateral ventricle on either side. So our insula is right here. So this is our lateral fissure. So if we take a look up here, we have our frontal lobe. So the whole area right here is our frontal lobe. Then we have the gnu. So this slice is a little bit different. I don't see the gnu on here. It would run right here. So that's our gnu of the corpus callosum. So we did the anterior commissure, which is right here. Then we have our third ventricle, then our thalamus, and our insula on either side. So right here and right here. So that's our insula. Here's our occipital horn and our temporal lobe right in here on either side. Okay. What else do we have? That's it. Let's take a look at the next one. Okay, so this is the T1. You can see our lateral fissure with our insula. We have the temporal lobe on both sides. And we have the, where are we? So here is our thalamus gland. So this is our anterior, that's our posterior commissure, and our third ventricle runs right in the middle. This right here is our pineal gland. This is our occipital horn of our lateral ventricle. Here's our occipital bone, frontal lobe, temporal lobe, and we'll label those in just a bit. So here we have our head of the caudate nucleus. This is the body of the caudate nucleus coming around to the tail of the caudate nucleus with the amblygata and the lentiform nucleus here in the middle. And then our thalamus is right there with it. So we're off to the side. We're going to have a sagittal image. So right here, we're going to start with the body of the caudate nucleus. And here's our thalamus right here in the middle, okay? We have our hippocampus, amblygata. So you got to remember what this looks like right here. Remember what this looks like. So the head of the caudate nucleus, the body, coming around to the tail, to amblygata with the lentiform nucleus in the middle and the thalamus, okay? So back over. So picturing this. So we've got the internal capsule, body of the caudate nucleus, the thalamus right here, and we have our lentiform nucleus anterior to that, amblygata. We have our hippocampus right here, lateral horn of the lateral ventricle. It's right here, head of the caudate nucleus. So head of the caudate nucleus, we got the lentiform and our thalamus on the inside, okay? All right, so looking here, and keep adding more and more on, right? So here is the frontal horn of the lateral ventricle right here. So here's your ventricles, okay? So here's the left, here's the right, comes down, and we've got our third anterior commissure, third, and then we have our posterior, so our occipital horn of the lateral ventricle on either side, okay? So right along the frontal horn of the lateral ventricle, we have the head of the caudate nucleus. This is what it looks like right here. So that's it. Then we come down, and you can see this is our insula. So we have right here is our claustrum, and the next one in is our lentiform nucleus, the two. So we've got right here, this one right here is the putamen, and this one right here is the globus pallidus. So those are the two. This is your thalamus. So you know where we're at now. Here's the occipital horn of the lateral ventricle. So right here, and this is your splenium of your corpus callosum. So a lot going on, right? Break it down, make sure it makes sense. So head of the caudate nucleus is, or I mean the tail is down here on either side. Okay, this is what it looks like on an MRI axial T1. So head of the caudate nucleus, then we have your insula right here, globus. So you can see right here, there's a little density change, and this is your globus pallidus, and this right here is your putamen. The two together are your lentiform nucleus, okay? So you can see your head of the caudate nucleus right there. This is your pineal gland right here. That little dot and is the middle of it, and it surrounds, okay? Thalamus is right, so it's right here. That is your thalamus. Claustrum. And you've got, you see the little line right there. So on either side, you can see it right there. Here's your external capsule and your internal capsule. Okay, we got a coronal coming. So it just looks so pretty. It looks like a flower to me. Okay, here is your corpus callosum. Here's your head of your caudate nucleus. This is your lentiform nucleus. Pituitary gland is right there. Here's your optic chiasm. Your supraciliary space is the space right in here. Okay, so that's your supraciliary, and that right there is your optic chiasm. Okay, here's your claustrum. You can see the line right there. External capsule runs just on the outside. Internal capsule is on the inside. And then your septum plucidium. And there's your corpus callosum. Going midline again. So here we go. All right. So we'll start with where do you want to start? We'll start with the punicles of the midbrain. So here's your midbrain. Posterior commissure right there. And we've got your pineal gland, which is right here. And I want you to know your cerebral aqueduct. So your third ventricle is here. So your cerebral aqueduct comes down to your fourth ventricle, right? Remember all this? Here is your cerebellum and your suprasellar or your cerebral tonsil. So remember I talked about Chiari syndrome. And then we've got your pons, your medulla oblongata, and coming down to your spinal cord or central canal, okay? Here's your suprasellar cistern. Then you have your pituitary gland. Now, just know that there's anterior and posterior in your pituitary gland. You have your infundulum, which is a little line right there, and you have your optic nerve, okay, coming right here. So remember we talked about how a pituitary adenoma would push up onto the optic nerve and give blurry vision. So your mammary body is here, and your hypothalamus is here, and your thalamus is right there. Your fornix, and they didn't label that, so that's perfect. So looking here, we're going to have a coronal image, and we do. So we've got a coronal MRI T1. We've got the lateral ventricle. That's actually the right lateral ventricle. The head of the caudate nucleus is right there. And right here, this is the lentiform nucleus. Optic chiasm is right here with your suprasellar cistern, and you can see the infundulum right there. It's connecting the two, okay? Here's your pituitary gland, your suprasellar cistern, anterior commissure. This is your temporal lobe. Here's your lateral fissure with your insula right there. Corpus callosum is right here, so it's the nerve fibers right there. I hope it's starting to come together. So we have another axial, and we've got temporal lobe, pituitary gland, basilar artery, vermis of the cerebellum, occipital. Here's your pons, prepontoon cistern, and your internal carotid arteries on either side. So here is your pituitary gland, and you have your carotids coming up on either side. So if you have a pituitary adenoma, it can compress your carotid arteries, and you can have a stroke from that. So this is the MRI axial T2, and it shows us fluid really well. Here's anterior commissure and posterior commissure, and then right here, and then you have your third ventricle running in between. Your pineal gland is right there. Here's the occipital horn of your right lateral ventricle. Here's the occipital horn of your left lateral ventricle. Here is a CT. As you can see, we don't see as much detail, but it does show us the calcified pineal gland and the coracoid plexuses, which are normally calcified in adults. So pretty cool, pretty cool. Third ventricle, that's pretty wide, so a little concern there. All right, here's an axial. T1, so if we're looking here, looks like it has contrast on board, so I can see the vessels really well. So we have the optic tract right here, so right where it's splitting, mammary body right there, and we've got the cerebral punicles of the midbrain, so on both sides. The hippocampus is right here. We have the ambient cistern, so on either side, and we have the occipital lobe right here. Oblongata is right here. Here's your suprasellar cistern and your lateral fissure. That's kind of a weird spot. You can see it starting right there. That's a better shot right there. Okay, here's the CT. So suprasellar cistern, ambient cisterns on either side, midbrain. We have your cerebellum. Here's the vermis, so you can see the lines. That's your vermis and your hippocampus, oblongata, and your lateral fissure. We're going to be looking at a coronal image. This is anterior. So this is our frontal lobe all up here. And we have the eye. So we talked about the superior, inferior, medial, and lateral rectus muscles. Here's your ethmoid sinuses and your olfactory tract. So that's your olfactory tract right there. Okay, so we're going to be looking at a coronal, pretty midbrain. So if we take a look here, we have the fornix, we have the cingulate gyrus right here, we have the thalamus, which is right here, temporal horn of the lateral ventricle is right there, posterior commissure, third ventricle is right there, your hippocampus is this area right here, okay, on both sides. Look at the semicircular canal, looks like a little pigtail, it's cute. And here's your lateral lateral ventricle, it's the right side, and your corpus callosum comes up and out right there. Pons, right in the middle. Okay, so if we take a look, we have the third ventricle goes down the cerebral aqueduct to the fourth ventricle, right? So we have, what do I want you to know here? The central canal, the spinal cord, medulla oblongata, you have your pons, and your midbrain. So looking here, we're going to get a coronal. We're pretty far back, so we have the penile glands, that little dot right there, and we have, I want you to know the cerebral aqueduct, we got a slice of it right there, cerebral punicles, and your cerebellum. All right, so looking here at a cross section, here's your cerebral punicles. On either side, you have the red nucleus, and I want you to know your cerebral aqueduct, and that should be good. So here's an axial. All right, so you have your middle cerebral arteries. So this is a specialty MRI that we're running right here. We haven't talked about it. We're not going to talk about it. You have your optic tract, so it's just a little bit different of a sequence. Here's your red nucleus. It shows it really well, so I like this image. And I want you to see your quadrigeminal cistern. It's in the back. And we're looking at another axial. This is a T1 with contrast. So if we take a look, here's your pituitary gland. Here's your basilar artery. I should have stuck with what I thought. Here is your pons, and here's your cerebellum. Your fourth ventricle is right in the middle there. Here's your internal carotid arteries. So there's one. It's coming up. We just didn't catch it exactly right. So you can see your optic nerves coming back. It's good. A little bit lower of an axial. This is a T2, MRI T2. So looking at the clivus, so remember the clivus way back when? Your CPA, your basilar arteries right there in the middle. And we've got your fourth ventricle right there. This is the vermis of your cerebellum and your medulla oblongata and your olives on either side. Looking a little bit further back in a coronal plane, this is a T1. So we have the pineal gland, the cerebral aqueduct. What I want you to know, the olives on either side, your cerebellum. All right. And this just gives you an idea of what we're looking at. So midbrain, pons, medulla oblongata, we got your fourth ventricle, your cerebral aqueduct here, your cerebellum with your primary fissure. So this gives you an idea what we're looking at here. So this is a better picture. You got your pons and your fourth ventricle, and your vermis is right here. It looks like a little worm to me. Your dentate nucleus is right in here. I don't think I make you label that though. So here we are just off from midline. So good sagittal image. And we've got the fornix, the thalamus, mammary body. Right here is your tectum. We've got your cerebral aqueduct coming down, your cerebral panicle, your cerebellum. Here's your fourth ventricle, your medulla oblongata, so midbrain, pons, medulla oblongata. Third ventricle, cerebral aqueduct, fourth ventricle, okay? So coming down, we have our cerebrum, so our cerebellar tonsil right there. And we've got our pituitary gland, anterior, posterior, with our fundulum connecting to our suprasellar cistern in this area. And here's our optic chiasm. And easy. Here's coronal further back. Taking a look here, we have our longitudinal fissure, our vermis, that worm-looking thing. Here's our cerebellum. Here's our tonsils right here, cerebellar tonsils. Dentate, nucleus, tentorium, cerebelli, remember that meshing in between. Here is the occipital horn of the lateral ventricle on the right. All right, so another coronal. So this one is good for the IACs. So you have your CPA with our basilar artery in here. It goes basilar artery, pons, fourth ventricle, vermis, okay? So middle cerebellar punicles on either side. Here's our IACs. This is our cochlea right here. I'll circle it, cochlea. And then our semicircular canals right there. That's a T2. Okay, so the vascular system of the brain. All right, so what I'm going to do is I'm going to start down here with the vertebral artery. It comes up in the vertebral foramen, comes up, and it goes to the basilar artery and does the posterior circulation into the brain, okay? Posterior cerebral arteries, okay? Coming up, we have the carotid arteries, okay? So we have the internal and external. So the internal carotid artery goes to the carotid siphon right here, so you can see that. And it comes up and we have the anterior cerebral arteries and we have the middles coming straight at us and our posterior communicators also, okay? Kind of hard to see them on that image. This is looking straight at someone. So we have the pituitary, our optic chiasm, and you can see the internal carotid artery coming up, siphon, and then it goes to the middle cerebrals, okay? And then the anteriors come just straight up. All right, taking a look here, we have our internal carotid artery and the carotid canal. So here and here. So this is our carotid arteries in the carotid canal right there. This is our basilar artery right there. Okay, so this looks more like what we run. So we do an MRA, take a look at the vessels of the brain. Now, I don't make you know all these, so don't panic. You have your internal carotid artery coming up to your siphon right here and coming up, and then we go anterior, okay? Middles come straight at us. Looking here, the verts, I call them the verts. So vertebral arteries come up to join into the basilar artery and then your posterior cerebral arteries, okay? So the vertebral arteries merge into the basilar artery, which does the posterior cerebral arteries. So looking here, this is looking down at the head. So looking, don't let this confuse you, okay? So here's your basilar, here's your vertebral arteries right here, and then you have the basilar right here, and then it goes to what are they saying these are? Vertebral arteries. So vertebral arteries, sorry, to the basilar. See, I even get confused. So they're bigger, that's why I screwed up. So you can see the vertebrals coming up, they merge together for the basilar. So looking here, here's our internal carotids coming up, and this is our middles, and this is our anteriors. Now in between, there's communicators, so anterior communicators. So it connects everything together. So if you look at something that's real small and it's connecting one to another one, it's a communicator, okay? So anterior communicators. So this is a normal. So we'll take this view and we'll flip it on its side. And this is what we get. So we get this is much easier for me to read. These are what I'm used to looking at. So we have our internal carotid coming up, our carotid siphon right here. Then we have our middle cerebrals. We have our anterior cerebrals with our communicator. And you can see our anterior cerebral and going to our middles. Okay, so this is a picture that I'm used to seeing. We run those all the time. Okay, so this is an MRI. And taking a look, here's our anterior cerebral, here's our middle cerebrals. We have back here in this track is our posterior cerebral arteries in our ambient cistern. Coming up, here's a CT-A of the vessels of the brain here. And we have middle cerebrals right here. So this is our middle cerebrals, and we have anterior cerebrals coming up, straight up at us, and around the back we have our posterior cerebrals. And they show the basilar right there. Kind of hard to see. Okay. All right, so this has been cut out. So we cut brain tissue out, all the other accessories out. And we do this in MRI and in CT. So every time we run vessels of the brain, this is what we're doing. So we come up our internal carotids and we go to our middle cerebrals and we have our anterior cerebrals. These are our communicatings in between. And then here's our left. And then there's different sections. There's 1, 2, and 3. So M1, M2, and M3, you'll hear the ER doctors and the radiologists dictating out it's an M2 or M1. M1, as you can see, if there's a blockage, it's going to wipe out that whole side of the brain in the anterior. If you have an M3, it's not as critical as even an M2. So you'll hear him talk about the different segments. If you have an M4, it's not even as bad. So, but if you have an M1, the patient's in a very, very bad critical state. Okay, so coming up off the aortic arch, we have the brachiocephalic, and it bifurcates into the subclavian and the carotid, and it comes around, and then you have your left carotid and your left subclavian coming off. So a little bit different, and we'll cover that a little bit more. So we'll come up, our common carotid will bifurcate into the internal and external, and come up into the brain with our siphon and our internal, and we go to anterior and middles, and then we have communicators, or the posterior cerebrals, that go to the posterior. The verts come up and they join to be the basilar, and then do the posterior cerebral arteries. Okay, coming off the arch. So here's our brachiocephalic trunk. Here's our right subclavian. Right here is our right vertebral artery. So here's our common carotid artery. Here's our external and our internal. Now the external does swing in and before it swings back out, okay? So it comes up, and here is our right middle and our anterior, with our anterior communicating in between. Okay, so you see the verts coming up, and it joins for the basilar. All right, so this is a cool shot of the right and left vertebral artery and joining for the basilar. So it's a good shot. That's a CT with contrast. And here we have vertebral arteries going to the basilar and to our posterior cerebral arteries. And here it is again. So we've got our verts coming up to our basilar artery, to our posterior cerebral arteries. Here, this is our vertebrals coming up into our basilar, and here's our posterior circulation. Here's our anterior circulation. You can see the internal carotids have been cut. Here's our middles, and here's our anterior. And this is another example of it all put together without them cut out. So typically, we take this and we'd cut out the posterior circulation. So we'd take this and we'd cut it just like this. We come around and we come up, and we cut this out. And then we'd have the anterior portion and we'd have the posterior portion, and we'd process these separately. Okay, so here's our anterior cerebral, posterior communicating. We've got our basilar, our vertebrals feeding into our basilar with our posterior cerebrals. And we've got our right posterior cerebral with our middles and anterior communicating, right, or anterior arteries, cerebral arteries. Okay, so just another picture of them within the MRI, and just kind of how they're laid out. So you can see the anteriors, the middles, and we've got the posteriors and the verts coming into the basilar. Okay, the venous system. So we take a look here. We have the superior sagittal sinus, okay, comes around, and we have what's called the straight sinus coming across, transverse sinus. There's usually clots within the transverse sinus or the straight sinus, one of the two. There's usually clots within there. So guys who do a lot of steroids, or girls on birth control pills that have been stagnant for a long time, they'll get clots in their venous system. So looking here, here's your superior sagittal sinus coming around. We've got our confluence of sinuses. Here's your transverse. Coming up is our straight sinus, and then it branches into our inferior sagittal sinus, and right here our so the septal is what I usually call it. So the internal cerebral veins. All right, so here's midline, and this is a CT with contrast. So here's our straight sinus. This is our great vein, so the vein of Galen. And then we have our inferior sagittal sinus. So the superior sagittal sinus runs up top, inferior sagittal sinus. This would be more like what you would label. All right. So this is it's cut out. So we cut it out. So everything else is removed. So you can see your superior sagittal sinus. So the inferior sagittal is kind of on top of it. Here's your confluence of where it all comes together, your right transverse and your left sigmoid. Okay, so the cavernous sinus. So here's your sphenoid, here's your ethmoids, your posterior ethmoids, here's your sphenoid, your internal carotid, and then there's a cavernous of sinuses right here. This is just showing the flow of the sinus. And here we go. So superior sagittal sinus, here's your straight sinus, here's your confluence where it all comes together. This is your internal cerebral vein. And your right here is your anterior cerebral artery coming up right there. Pretty cool. Okay, so let's take a look here. We're almost through it. This is a long one, I'm sorry. Here's your frontal sinus, olfactory bulbs. So here's your frontal lobe. Here's your olfactory tract. Here's your pituitary, your sphenoid sinus, your superior nasal concha, middle nasal concha, olfactory nerve fibers. Here's your hard palate and your cribriform plate. Here's midline, so let's take a look here. You've got your thalamus, your hypothalamus, and your infundulum right there with your pituitary gland. And then that little line right there is cranial nerve number 1. Okay, looking here, it's your frontal lobe, and we've got your olfactory and your ethmoid sinuses. Got a little sinusitis here, you see that? All right. So you have your cranial nerve 2, which is your optic nerve, and here's your pituitary gland. And remember, we angle for the orbits, so we can follow the optic nerve. So you can see here, they cover it again. So you have the lens. So you have your anterior chamber, your lens, your posterior chambers. You have your retina right here. This is your globe. The whole thing is called the globe. You have your superior rectus muscle with your optic nerve, which is optic nerve number 2, and your inferior rectus muscle and your sphenoid sinus. Maxillary sinus. Sphenoid is not being shown. Okay, so this is how it crosses, and it crosses over your optic chiasm. This is your optic tract in the back, and which is right at the level of your pituitary gland. So we can see it here. We've got your cavernous sinus, your sphenoid, and I won't make you know all that. That's just me. You'll never remember it. Okay. So cerebral punicles, you have your pons and your trigeminal nerve. It's right there. Vestibule and vertebral artery coming up right there. You catch a piece of it. And looking here, we've got your CPA with your basilar artery, your pons, your fourth ventricle. Here's your cerebellum. You have cranial nerve number 7, number 8 right in here. Here's your cochlea and your semicircular canal. So it's a really good one of your semicircular canal. All right, so review. Here's your olive and your vertebral arteries. So you're pretty low on this one. So your CPA and your jugular foramen is right there, and your medulla oblongata and your cerebellum right there. Okay, so long lecture, I apologize. There's a lot to the brain. You should watch this a couple times. Go through your book and make sure you understand it before you take your quiz.